Hi, Mr. Robinson. I'm Robin. I'll be your nurse today. We're going to be looking at your left heel. You have a little bit of an ulcer on there. Okay. And we're going to take a look at it today. And we do have a dressing order for you. Do you take care of it at home yourself?
Nope.
Okay.
Well, I smoked 2 packs a day, and I probably
All right.
for the last 2 years or so. And I had asthma when I was a child.
So to help with your sleep,
All right. We're just going to take that old Band-Aid off.
I've never heard of that either.
so we'll be talking about what to
And we're going to go ahead and cleanse that area. Make sure you're washing your hands before you put gloves on. Are you able to do this at home? Okay?
Mm-hmm.
Okay.
That sound all right?
Yeah, that sounds good.
It's that's a shortening way of saying chronic obstructive pulmonary. And it's a chronic disease that alters yours.
Alright, I'm going to go ahead and measure this first. That way we can document and see from next time you come in if it's gotten any bigger. And it's 3 centimeters by 2 centimeters.
Do you exercise a lot?
Well, I probably walk like 3 times a week for 15
Alright, now we're just going to make sure we cleanse that whole area.
What do you clean it with?
We're cleaning it with normal saline. And I can send you, it's just a cleanser. It doesn't irritate the wound at all. And I'll send some home with you.
Is it expensive?
No, your insurance will cover it.
I could just use the vodka I have at home.
No, that would really irritate that wound.
Alright.
I think it'd make it worse. Leave that for your drinks. Alright. And we're going to make sure we cleanse that whole area.
The first lip reading that I'm going to teach you, it helps with decreasing the amount of carbon. So I'm going to put it under.
And wash your hands in between dressing changes. Especially when we're putting a new one on.
Okay. So first, you're going to breath in through your nose, and then you're going to exhale at the top through your mouth and keeping your lips tight. You don't need to go deep.
So what's your activity level at home?
I don't do a whole lot. Get my refiner.
Okay.
All right, well, I'm going to explain it one more time. And
We're going to want to make sure to kind
in through your nose, and keep
of, whenever you're in bed, make sure you elevate your heel, as it is now. And make sure to keep that area clean.
So now I'm going to show you a little
So what kind of nutrition are you getting at home?
What this is it close to the level
I eat out a lot.
Okay. Well, with wound healing and to prevent it from getting any worse,
right now?
we're going to want to do a little different nutritional guides here. I have a guide here, and it gives you a list of different foods that are nutritious that promote healing. They're called power foods. They are your proteins like meats, beans, eggs, milk, yogurt, soy nuts. Vitamin C is your citrus fruits and juices, your tomatoes, your tomato juice, peppers, baked potatoes, spinach, broccoli, cauliflower, Brussels sprouts, and cabbage. You want to increase your vitamin A. That's your dark green leafy vegetables, orange or yellow vegetables, cantaloupe, liver, or fortified cereals.
I like liver.
Oh, good. And your zinc
Or maybe you should
is
explain.
some red meats and seafood.
Well, when you should do it is
I'm also going to send you home with some Juven. It's a nutritional supplement, and it comes in a powder form. And you just mix some water with that. And you're going to be drinking each packet.
now that
twice a day.
about that, can you summarize?
And this will all explain in the pamphlet I send home with you. And we're also going to want to check for signs and symptoms of
Air
infection.
that's trapped in my lungs.
Do you know what any signs and symptoms of
A
infection?
little bit of shortness of breath, and it's
I
probably
don't
because
think
of my
so.
smoking.
Okay.
Probably quit.
That's going to be increased pain on your heel. There's also going to be some redness and swelling around the
Do
site,
that because of the increase
and it
in
might
my
feel warm to the touch.
and the oxygen
Also
in
might
and the
have a foul odor when you take the dressing off.
out.
if you're running a fever, feel nauseous, you're definitely gonna wanna give us a call. If there's any change in color of the drainage, if there's a yellow color to the drainage, also give us a call. We'll take a look at it. And we also want to keep that area really free from injury. We don't want to be rough housing on it. Make sure it's elevated when you're in bed, or make sure your feet are up in your recliner. We're just going to try to do as much as we can from this progressing. Do you understand the nutritional benefits?
Very good.
Do you understand the Juven?
It was over 5 minutes.
Okay. And what I'm going to send home with you is just some discharge instructions. And these will help you on just little tips of washing your hands, keeping a clean dressing on your wound, eating right, and then how to change the dressing, remove the old dressing, and there's some info about saline solution right there for you. Also in this brochure I'm sending home with you is a step-by-step of how to clean the wound, how to apply the new dressing, and how you should call your healthcare providers of these signs and symptoms of infection. Down here I have our number to contact us if you have any questions. And then here is another list of just different proteins and carbs, milk and dairy products, vitamins and minerals. So you're just going to want to take a look at that too. So I'm going to send you home with this. I'm going to create like a little bag to send you home with of the normal saline, your new dressings. And do you have any questions? Okay. I'll also send some Juven home with you. It's not the greatest tasting, but it's really good for you. So try to incorporate that twice a day. Any questions or anything? All right, well, nice to meet you. All right.